All right, ready to dive into some fascinating research today, all about patient safety in nursing.
Absolutely. Should be a good one.
You send over so much research, notes from your own experience, even some historical stuff.
Yeah. Well, it's all connected.
It really seems like you're on a mission to understand how healthcare systems work,
Especially the role nurses play in all of it.
which, when you really think about it, is huge.
It is huge. I mean, we get caught up in the headlines about the latest medical breakthroughs, but the real foundation is built on safe, effective care every single day.
And that's where quality improvement comes in, huh?
Exactly. It's about striving for better outcomes for every patient, every single time.
You know, it's funny you should mention that. When I was looking through all the material you sent, I was reminded of something a friend of mine was telling me. She was saying how, after a surgery she had, this nurse, despite being completely slammed, took the time to really listen to her concerns. And turned out, the nurse's attentiveness actually helped catch a complication early on. It really just made me think about how quality care isn't just about, procedures.
No, not at all.
It's about that human element, too.
It's huge. That's such a powerful example, and it really highlights something important. When we talk about quality in healthcare, it can be defined in so many different ways. Your research actually touches on this, explaining how quality boils down to how well those health services actually increase the likelihood of achieving those desired outcomes.
So are we consistently using what we know works to get the best possible results?
Basically, yeah.
Interesting.
And this isn't a new idea.
Well, I was going to say, I'm seeing some stuff in here about Florence Nightingale,
Yeah.
the OG of nursing.
Exactly.
No.
She wasn't just about dimming the lights and fluffing pillows.
No.
Your sources point out how deeply concerned she was about improving those healthcare conditions.
Really? How far back are we talking here?
As far back as the 1850s?
Wow, the 1850s?
That's what I'm saying.
What was she doing back then that was so revolutionary?
Okay, get this. She was a huge advocate for improving sanitation in hospitals.
Oh, well,
Back then, people didn't really connect hygiene with health outcomes.
I guess that makes sense.
She was one of the first to systematically analyze data and prove that cleaner hospitals meant fewer infections and better recovery rates.
Talk about ahead of her time.
Right.
So when did this emphasis on quality become a widespread concern in healthcare? When did everyone else catch up to Florence Nightingale's way of thinking?
Well, it took a while, but things really started to shift in the 1990s. That's when the Institute of Medicine, or IOM, published a report that sent shockwaves through the healthcare system.
Dramatic entrance for the IOM. What did they uncover that was so shocking?
Okay, so remember that friend of yours that you mentioned?
Yeah.
Imagine if that complication after her surgery had been missed because of a system error, not just an individual's oversight.
Oh, okay.
That's what the IOM report exposed. How rampant substandard care, inefficiencies, and waste really were in healthcare.
Substandard care. Okay, how substandard are we talking? Give me an example.
One of your sources, a research paper on medication errors, actually highlights a pretty chilling statistic. At the time of that report, preventable medical errors were estimated to be the 8th leading cause of death in the U.S.
8th leading cause of death. Are you serious?
Yeah, that's more deaths than from motor vehicle accidents, breast cancer, and AIDS combined.
Oh, wow. Okay.
That's one of the things that really put the spotlight on quality improvement, or QI.
Wow, 8th leading cause of death. That's definitely a wake-up call. So is that when everyone started talking about quality assurance and quality improvement? Are those the same thing?
They are related, but not quite the same thing. Imagine two amazing nurses on your floor. One's the meticulous chart checker, making sure every I is dotted and every T is crossed.
Okay.
That's like quality assurance, or QA, making sure we're following the rules.
Gotcha.
And meeting the standards we already have.
Okay, I get that. So if that's QA, what does that make the other awesome nurse?
Imagine the other nurse, the one who's always suggesting ways to streamline procedures or make patients more comfortable, always tweaking and improving.
Oh, okay.
That's quality improvement, or QI, proactively seeking out better ways to do things.
So QA is about maintaining the standard.
Yeah.
And QI is about raising the bar.
You got it.
Okay, I like that. But how does QA actually work in practice? It sounds like a pretty big job.
It is a big job. And it's broken down into 3 main areas: structure evaluation, process evaluation, and outcome evaluation.
Okay.
Think of structure evaluation as making sure the stage is set for success.
So that's like you walk onto your unit and...
Exactly. You're checking. Is the equipment working? Are supplies stocked? Is the layout of the unit itself actually conducive to good care? You've probably experienced firsthand how a chaotic, poorly designed space can impact patient care.
Oh, you're preaching to the choir. I once worked a shift where the supply closet was basically a black hole.
Yeah.
Nothing was where it was supposed to be. It definitely added an extra layer of stress to an already demanding job.
I can only imagine. So let's say the environment is in good shape. Then process evaluation comes in, examining the nitty-gritty of how care is delivered.
Taking a closer look at those everyday procedures.
Right. Is the care appropriate for the patient's needs? Is it timely? Does it follow those established best practices? Think about medication administration. Maybe you have a story from your own nursing notes. A situation where following the process precisely was absolutely crucial.
Do I ever? There's that saying, right? Nurses, it's not what we do, it's how we document it.
Yeah.
But seriously, there was this one time, and it's like seared into my memory. I was literally about to administer a medication, and something just said, double check.
Oh, wow.
And I'm telling you, turned out, because of a really similar sounding drug name, the pharmacy had accidentally stocked the wrong medication. If I hadn't followed that verification process to the letter, scary stuff.
That's exactly what process evaluation is all about. Those safeguards are there for a reason. They might seem tedious sometimes, but they can truly be the difference between a good outcome and a potentially catastrophic one.
Chills, literal chills. That's why I love nursing those high-stakes moments where your attention to detail really matters. Okay, so we've got structure and process. What about that last one, outcome evaluation? That one seems pretty self-explanatory.
It does, doesn't it? It's all about measuring that impact on the patient. Did they improve? Were there complications? Tracking things like those hospital-acquired infection rates. Those are key indicators of how well the whole system is working.
Makes sense. You know, it's funny, when I was gathering all this research for you, I started noticing these concepts playing out in my everyday life outside of the hospital.
Oh, really?
Yeah, like even something as simple as cooking a new recipe, you know. I realized I was doing my own little mini structure evaluation by making sure I had all the right ingredients and tools before I even started.
I love that. It really underscores how universal these principles are. We might not call it quality improvement in our daily lives, but that mindset of observing, analyzing, and striving for those better outcomes, it can be applied to almost anything.
It's like we're all secret QI agents without even realizing it.
Right.
But speaking of high stakes, this is where I think those startling statistics you shared about medical errors really hit home. We're talking the 8th leading cause of death in the U.S. That's a sobering thought.
It is sobering, and it underscores why this deep dive you're doing is so important. The good news is that, according to the research you've gathered, a huge percentage of those errors are preventable.
Okay, give me a number. How huge are we talking here?
Some estimates say up to 80%.
80%. Okay, now that's empowering. So what are some of the most common causes of these preventable errors? Is it always about individuals like messing up, or is there more to it?
That's where things get really interesting, and where the systems thinking aspect of QI comes into play.
Yeah.
Think back to that medication mix-up you described. Yes, you caught it, but what if there were systems in place to prevent it from happening in the first place? Like maybe better labeling protocols, or technology that flags similar drug names.
Right. It's not about blaming the individual pharmacist. It's about looking at the whole system.
Exactly. And this is where your role as a nurse and the role of all nurses becomes absolutely critical.
Okay, so how do nurses fit into all of this?
You are the eyes and ears, the frontline defenders against medical errors. Think about it. You're with those patients constantly, observing their conditions, administering medications, communicating with doctors, other specialists. You're in the best position to spot those potential issues early on, often before they even escalate into full-blown errors.
That's true. I've definitely had those moments where something in a doctor's order just didn't seem quite right, or I noticed a change in a patient's condition that, like, others might have missed.
Exactly. And speaking up in those moments, advocating for your patients, questioning discrepancies, suggesting those improvements, that's where you become a powerful force for patient safety.
You're making me feel like a superhero. But seriously, it's not always easy to speak up, especially when you're dealing with doctors who might, like, outrank you. Or a system that feels resistant to change, you know? It can be intimidating.
You're absolutely right. That's why creating that culture of safety within healthcare settings is so crucial.
Okay, so tell me more about this culture of safety idea. What does that actually look like in practice? And how do we actually build that kind of environment?
It's about moving away from the blame game and fostering an environment where everyone feels safe speaking up about errors, near misses, or even just potential concerns without that fear of punishment or retribution.
Because let's face it, everyone makes mistakes, especially in a high-pressure field like healthcare.
Absolutely. We're human. We get tired. We get overwhelmed. It happens. In a culture of safety, the focus is on learning from those mistakes, not punishing them. It's about asking, why did this happen? Instead of, whose fault is it?
That makes so much sense. It's like you wouldn't blame a pilot for a crash if it turned out the plane hadn't been properly maintained, right? You'd want to investigate the system that allowed that to happen.
Precisely. We need to design healthcare systems that are resilient, that anticipate that human error, and that make it easy for people to report potential problems without fear. And your research actually highlights a simple but effective tool that empowers nurses to do just that. The CUS acronym.
CUS. Okay, I'm intrigued. Break that down for me.
It stands for Concerned Uncomfortable Safety Issue. It's a clear, concise way for nurses to voice their concerns without feeling like they're pointing fingers or making accusations.
Oh, I see. So instead of saying like, hey, I think you prescribed the wrong dosage, you could say...
Exactly. Imagine this, Dr. Smith. I'm a little concerned about the dosage on this new medication order. I'm uncomfortable administering it as written because I'm worried it might be too high. And I think it's a potential safety issue.
That is so much better. It's direct, but not confrontational. I love it.
It's all about creating those open communication channels, so those concerns can be addressed before they turn into something more serious. And when nurses feel empowered to speak up, it can lead to real, tangible improvements in patient care.
It's about moving from a culture of blame to a culture of learning and improvement. It makes you wonder, though, are there any real-world examples of hospitals or healthcare systems that are doing this well? Like, who's setting the gold standard for patient safety?
That's a great question. And luckily, there are some fantastic organizations out there leading the charge and providing valuable resources for those healthcare professionals who want to make a difference.
Okay, so for nurses listening and anyone really who's passionate about making healthcare safer, who are these quality crusaders, these patient safety champions we can all learn from?
Well, you've actually gathered some information on a few of them. First up, we have the Agency for Healthcare Research and Quality, or AHRQ.
AHRQ, yep, they ring a bell. They're the ones with that amazing website, PSNet, right? It's like a treasure trove of patient safety resources.
You know it. And it's not just for healthcare professionals either. Anyone can access these resources. Tips for preventing medical errors, strategies for measuring healthcare quality, it's all right there.
Oh, absolutely. It's amazing how much information is freely available. But with so much out there, it's helpful to have organizations like AHRQ curating and vetting it all. It's like having a trusted guide in this vast world of patient safety knowledge.
I like that. A trusted guide. And speaking of trusted guides, when it comes to empowering nurses specifically, the American Nurses Association, or ANA, is a real force to be reckoned with.
The ANA, yes. They're all about supporting nurses and advocating for better working conditions, right?
That's right. And they recognize that better working conditions for nurses directly translates into better care and safety for patients. They've been super active in promoting quality improvement initiatives and developing resources to help nurses be those patient safety champions we were talking about.
It makes me think of that saying, nurses, the ones who whisper in the ears of power. They bring that unique perspective on what's really happening at the bedside.
Exactly. And the ANA has given them a platform to share those insights and advocate for change. One of the tools they developed, which you highlighted in your research, is the National Database of Nursing Quality Indicators, or NDNQI.
The NDNQI. Okay, yeah. I've heard other nurses talking about that. It sounds like it's all about data. Data
is power, right? The NDNQI is this massive database that tracks all sorts of nursing-sensitive indicators. Patient falls, pressure ulcers, those hospital-acquired infections, all those things we talked about.
So it's like having a real-time snapshot of what's happening in hospitals across the country.
Exactly. By analyzing all that data, they can identify trends, see what's working well, and pinpoint areas where those improvements are needed. And then that information is used to develop best practices and guidelines to make care safer for everyone.
Okay, so we've got HRQ providing resources for, like, everyone. ANA empowering nurses specifically. Is there an organization that's focused more on the big picture, like holding healthcare organizations accountable for meeting certain safety standards?
You're thinking of the Joint Commission. They're an independent, nonprofit organization that accredits healthcare organizations in the United States.
Right, the Joint Commission. So they're the ones who, like, walk into a hospital and say, all right, show us what you've got. Are you meeting the bar for patient safety?
That's them. They have these rigorous standards that hospitals have to meet in order to be accredited, and patient safety is a huge part of that.
That makes a lot of sense because, let's face it, hospitals want that accreditation. It's a mark of quality.
It's a big deal.
Yeah.
and it creates a powerful incentive for hospitals to prioritize those safety improvements. What's really cool is that the Joint Commission also recognizes the importance of patients as active participants in their own care. They have a program called Speak Up that encourages patients to ask questions, voice concerns, and advocate for themselves.
I love that because sometimes as patients, we're afraid to speak up, We don't want to rock the boat or question the
Right, but the truth is, no one knows our bodies better than we do. If something doesn't feel right, or we have a question about a medication, we have a right to speak up. And when patients feel empowered to do that, it can actually prevent errors and improve outcomes.
It's like what we were talking about earlier. That culture of safety has to extend to everyone, from the nurses on the front lines to the patients themselves.
Exactly. It's a shared responsibility.
Right.
And organizations like the Joint Commission are playing a key role in making that happen.
It's inspiring to see how much progress is being made in patient safety. We've come a long way since Florence Nightingale was advocating for cleaner hospitals back in the 1850s. But as you've highlighted throughout this whole deep dive, there's always more work to be done.
Absolutely. And the work isn't limited to healthcare either. The principles we've discussed, systems thinking, error prevention, continuous improvement, those have implications for any field where human lives are at stake.
It makes you think. What if we applied these same rigorous safety standards to other industries? Imagine the possibilities.
Now, there's a thought-provoking question to leave our listeners with. How can we take what we've learned from healthcare and apply it to make other systems safer and more effective? It's a challenge worth pondering.
It's about recognizing that we're all part of these complex systems, and we all have a role to play in making them safer.
Exactly. So to our listeners, keep asking those tough questions, keep advocating for those safety improvements, and keep striving for those better outcomes in everything you do. Because even small changes can have a ripple effect, making a big difference in the lives of others.
Well said, couldn't agree more. That's about all the time we have for today's deep dive, but this is a conversation that deserves to continue, so to our listeners, keep thinking, keep questioning, and keep pushing for a safer world for all of us.